Welcome back, everyone, to this parallel session on the advancement of telehealth. Everybody, let's welcome Jim Lim, the healthcare sector lead from NCS. Jim, take it away.
Thank you. Thanks, everyone. Thanks for attending the session. Okay. Need to take out my mask. I'm all alone here without anyone here, so I guess I can take out my mask. Okay, thanks for joining the session. It's always not a very good session right after lunch. Hopefully, it's not going to make you asleep, right? You had a good lunch, and then we can discuss briefly about telehealth. So I think my topic is falling under the track called empowering citizen and patient, right? So telehealth is definitely one of the many examples that healthcare providers or technology providers are putting the health at the hand of the citizen and the patient. So today I'll use telehealth, which is actually central to my heart, and I have the experience, honor working with two of the largest telehealth providers in the world, and that's where I can share my experience over here. Okay, I need to carry an iPad here because that's for the Q&A later on, right? Okay, so very quickly about myself, very quick introduction. So like what the host has mentioned, I actually currently is the NCS sector lead, a partner in NCS itself. And prior to that, I was actually the Good Doctor founding CEO in ASEAN, right? That is a joint venture between Grab and Ping An Good Doctor from China. And prior to that, I was Huawei as the regional CTO, and one of the portfolio is to start the healthcare practice for Huawei in China itself. Okay, quickly, NCS Healthcare. We actually have, NCS is celebrating its 40 years this year. And for NCS Healthcare, we're actually 30 years developing and maintaining different systems for the healthcare sectors, mainly in Singapore with the public and the private healthcare, but also there were some regional ventures in the past as well. And moving forward, NCS will be looking at growing the digital healthcare ecosystems as well as venturing into regional healthcare, right? And healthcare here, later on you will see, we're not looking at just in hospitals, right? Which I think that is one of our key focus for the past 30 years. We are also looking at moving from sick care into healthcare and into what we call community-based care. Okay, very quickly, right? Current healthcare landscape for healthcare innovations. Before joining NCS, I was in healthcare startups, Good Doctor Technology, right? And also in Huawei, working with lots of healthcare startups. So I'll call them the digital disruptor. It's like how Uber and Grab disrupted the transport industry. There are many, many new healthcare or medtech startups that's trying to come in and disrupt the industry. But disrupt here doesn't mean a negative sentence or negative words, right? It's really trying to improve the entire healthcare systems through digital technology, which I think in the morning, many speakers actually talk about how digital health, and I think I heard, was it Dr. Quek from NUHS, I think, right, mentioning that the future doctors need to be trained in digital technology as well. So I think that's a trend moving forward, right? Digital disruption is impacting many industries, including healthcare. In fact, when I was in China for the past years, I realized that China government actually put healthcare and education as the last two industries to be digitally disrupted in China. And that's where we look at edutech, healthtech, and medtech as the future trends to go. And coming back to Singapore in 2019, 2020, I have the honor and privilege of joining NCS to lead the healthcare practice. And that's where me and my team actually works a lot closer with the hospitals and in the local systems, right? So I see that there's a lot of digital transformations, the healthcare provider, the healthcare institution, or sometimes we may call them traditional healthcare providers. I know people don't like the word traditional, right? But when I was in the digital disruptor front, we actually call them the traditional healthcare providers, right? There's a lot of digital transformations, and NCS also have the privilege of working with some of them in whether is it the digital health in terms of robotics or in terms of even patient monitoring devices, right? So there's a lot of digital transformations ongoing in the healthcare institutions. But again, which one is going to move faster? Which is going to take the lead in digital transformation or digital disruption? I think it's wait to be seen. Healthcare is not an easy sector, right? Coming from a technology world, I can say healthcare is not an easy sector to be digital transformed or disrupted, right? Because there's a lot of patient safety, there's a lot of different types of data over many years in terms of privacy and security concerns. So it's not as easy as a normal consumerization of any other industry. Very quickly, I think one of the key things why digital disruption or digital transformation happens It's really because there's this well-known thing called iron triangle of healthcare, where you have to balance between cost, quality, and access, right? There's a lot of saying to say that you can't fulfill all three at one time, right? When you want to give better access to people, let's say remote healthcare in a remote location, right? In a small village in, let's say, Indonesia, right? You can't really provide the healthcare easily at an affordable cost because you probably need to lay cable for good connectivity there, or you need to send people there just to take care of the remote patients over there, right? But with digital technology, actually it changed, right? The iron triangle of healthcare actually is and can be disrupted with digital technology. But of course, again, as I mentioned, it's not as easy as it may be, right? There are many considerations. Either you can provide the access, right, with, let's say, the latest 5G or very dedicated connectivity, or you can improve the quality, right, by having, let's say, diagnostic devices, or you can do what we call, and what we are going to discuss today a lot on telehealth or telemedicine, right? But the cost may be high, right? So digital health definitely can provide and disrupt some of this, but not everything. And even if the cost can be lower, quality can be ensured, and access can be provided, there are other considerations, which I will have one slide on that. That's the security considerations. And security encompasses your basic security in terms of connections, and also your, most importantly, the privacy of the data. Let's look at the new normal, right? We all know, in fact, after coming back to Singapore, I realized that I was mentoring in ecosystems about different startups, right, in China. And I realized that over the past, I would say, since COVID started, especially in 2020 and 2021, there are plenty of new health tech and medtech startups looking to talk to us for funding and investment, right? Everyone is trying to provide some form of health tech and medtech companies to address the needs of the COVID situations, okay? But again, before all this health tech and medtech become new normal, what we have actually talked a lot when we talk to different government, when I was in Huawei, doing different regional or government and national ICT policy and program, we actually talk about healthcare as one of the key things to be focused on, right? Many reasons for that. In many countries, right, including Singapore and many countries in Asia, right, aging population is a key consideration, a key factor, a key thing that's coming up, right? Even in Vietnam, there was a report to show that by 2050, more than 50% of Vietnam, which is a relatively young nation, will have aging population problem. And of course, needless to say, Taiwan and Singapore has been well known as the aging population next frontier, right? Of course, as I mentioned, the iron triangle of healthcare. Cost is another thing that hopefully with the digital technology can be reduced, right, to provide affordable and quality healthcare still, right? Efficiency, right? There's a lot of talk today and probably tomorrow about AI. AI to enable accuracy as well as efficiency in healthcare providing and healthcare solutions, right? Even in the United Nations, one of the SDGs, the Sustainable Development Goal, talk about number 3, right, well-being and health for everybody, right? And there are many reasons, right? Personalized healthcare that people are looking for as well, right? These are the things that is driving to have affordable and quality healthcare. And as we can see from research from Gallant Grove with EDB about 2 years ago, there are more than 170 companies or health tech / medtech companies being set up in Singapore, right, about 2 years ago, right, just to address the new normal. And of course, you can see from the pie chart here, I'm not sure, is it too small for you to see on the screen, but I believe you will get a snapshot of some of these slides later on, right, is that there are different ways and different types of health tech and medtech startup, right? Today, many of us may think that the health tech and medtech is about telemedicine, teleconsult, right, and maybe some form of medicine delivery. But actually more than that, right? As we mentioned, healthcare is not just about the sickness or the consultation, right, or the outpatient itself. There is a lot of health management, right? There's a lot of diagnostic capability that's lacking currently that makes telemedicine cannot move as fast as it wanted to be, right? So there are different companies, and unfortunately, to some extent, there are point solutions. They are trying to address the different needs and over the entire continuum of the healthcare spectrum, right? And I think just now, right before me, the session by Dr. Sham, Dr. Julian Sham, right, I think, and others were talking about a problem of integrating different data from different sources. And by having these types of point solutions, Yes, it helps to address the needs of certain requirements of the healthcare ecosystems, but we still have a challenge, right? Before we can solve it, before the entire telemedicine can really take off very, very fast in the right way or in the desired way that we want to, right? There is a need to integrate the data into some kind of common platform. Right, like I mentioned, right, telemedicine is one of the key trends in the entire digital health that is either developed by many of the digital disruptors, right, or there are companies or there are healthcare institutions trying to do digital transformation, and they are also introducing telemedicine and different types of the digital health initiative, right? So as we can see from this, this picture, this PowerPoint slides, right, telemedicine has a good growth in terms of the potential market size moving forward, right? $100 billion. And of course, there are many different types of telemedicines, right? From what we are very well known in COVID situation today is teleconsult, right? A lot of us may not be physically walking into a GP clinics anymore, right? Especially now in Singapore, we launched this home recovery scheme where the government is actually promoting and encouraging people, right? If you are feeling sick, right? If it's a mild symptoms, maybe instead of walking down to a clinic or maybe even to a A&E in a hospital, please try teleconsult. And I have my friends in Dr. Anywhere, Wyman and others, all are involved in this initiative of providing teleconsultation or telemedicine facilities to those in the home recovery scheme, right? So telemedicine is definitely one of the key areas, and we can discuss it later, right? From my experience in Babylon as well as in Good Doctor Technology, one of the key things I realized is that there is a lack to some extent, tele-diagnostic capabilities, right? We still need to do a lot of that part of things so that we can move further. The other one is patient monitoring devices, right? There are many companies, and later on you will see Ping An Good Doctor in China, focus a lot on chronic disease management, like diabetes, right, high blood, and all those things. So definitely, from a chronic disease management perspective, you need to have good patient monitoring devices. And that's where I say the tele-diagnostic capabilities is lacking, right? So is it just enough with an oximeter at home? Is it just enough with a blood pressure monitor at home? Well, for some basic needs, it may be good enough. But for chronic disease management, do we have a heart failure monitor that we can use at home, right? And it can also be integrated directly into the hospital or the clinics, right, to our doctors who can immediately catch the irregularity and maybe send an ambulance to pick us up and go to the hospital. So how does all these different devices be connected, right? I think there's a connected healthcare talk about it in the morning as well. So how are all these things being connected, different devices, different protocols, different connectivities, and most importantly, having the necessary data in different forms that we need to integrate them together so that we can do the chronic disease management at home or at a community-based care, such as elder home or any types of community-based care that is needed. So that's something to be discussed as well, right? Last but not least, healthcare assistive robots, right? Robotics. So today, some of you in Singapore may know that there's this robot nursing assistant called Florence that NCS worked with many institutions to kind of do inpatient ward monitoring and services, right? So that's just one part of the many robots. There is also many types of robots, let's say a TEMI robots in some of the hospital becoming like a pathfinder, right? So there's another type of service robots, right? I think during the COVID situation when there is a quarantine order and all those things, there are also patrol robots, right? Some from Boston Dynamics that is going in the parks as well as in some of the facilities to monitor. So I would say robotics, not just in healthcare industry, right? In many industries, robotics is going to be complementing a lot of the lack in the human task force or workforce, right? And providing the necessary support and again, disrupting the iron triangle of healthcare, right? By using robotics. So looking forward to more robots, but again, how do these robots talk to each other and how do they integrate with each other? I think that is something to be looked upon and discussed. Quickly move into telemedicine. That's one of the key things we want to look at today, right? And this is probably one of the first few that really put healthcare to the hand of the patient and citizen themselves, right? There are two types of telemedicine. Of course, one is the traditional, right? Sorry to use the word traditional, but the traditional healthcare institution really trying to provide telemedicine as another channel where they can consult the physician and the doctors, right? But what I've listed here is actually the telemedicine startups. This is an example in Singapore, right? Because I'm in Singapore today, right? So we have the very famous Dr. Anywhere, we have Whitecoat, right, which are probably the two leading ones. Then we have some specialized ones like HiDoc, who focus on specialized, specialist services and concierge services, right? And today, telemedicine, like I mentioned, focus a lot on the teleconsult itself. I still see a lack in the telediagnostic capabilities that I think is very important and required and critical to really complete the entire ecosystem offerings, right? So there's a lot of focus in teleconsult today. And in Singapore, probably due to the, I would say, the regulations, there's a need for a lot of video consult rather than text-based consult, which when I was in Good Doctor, we actually launched text-based consult and using AI technology in an AI triage manner. Okay? So today in Singapore, we do a lot of video or audio consult at a minimum and not so much on a text-based consult, right? And of course, there are other key offerings by these telemedicine providers, such as medicine delivery, right? Some of them work with Gojek, with Grab, right? Some of them have their own delivery arm, right? So this is another important thing. I would think that in Singapore is, you may not see the impact that great, right? Except that when you are very sick, you do not want to go out, you wish that the medicine is delivered to your doorstep, right? But in bigger countries, let's say in China and in Indonesia, which I've seen, right? Medication delivery is very, very important because of the constant traffic jam. It may not happen in the COVID situation today, but the long distance is still a key factor where medicine delivery, and those like in China, the logistic is really very good. So they always promise, let's say, 30 minutes or maximum 1 hour medication delivery. So these are really very important, right, for a patient who is actually trying to recover at home or do a teleconsult at home, right? There are other things like lab tests, right? Again, we may not see a lot of them in Singapore today because when I speak to my friends who are not in healthcare sectors, they still think telemedicine today is something they will use because of teleconsult or maybe to get a digital medical certificate, right? That is the primary reasons why many of them use telemedicine or telehealth platform today in Singapore, right? But actually, when I look at it, many of these telemedicine startups, they are not integrated to the data available in a hospital or in the traditional healthcare institutions. So where do they get the patient data? Because you need to do profiling, right? With profiling, you can do personalization. So without all this medical history, you can only rely, right, for this startup, rely on your platform to ask the questions from the patient. But how many of the patient, although we're trying to empower the patient and citizens here, but how many patients and citizens can really give what we call potentially medical grade, medical history and their own data to the platform, right? So the entire non-integration to the patient data is a challenge, and I will see that if there's a way where the traditional providers and the digital disruptor can work together to ensure the data is somehow, of course in a secure manner, right? Somehow being able to exchange between the disruptor and the traditional provider, that would be great, right? That is something that I think, from my past experience, is lacking, and it will really help to move the entire telemedicine to the next frontier. There are also some specialized ones in Singapore, like SpeedDoc, which provide house care service, right? So these are the specialized telemedicine, and there's needs for every one of them as well. Okay? So very quickly, after looking at the 6 main providers in Singapore, let's look at the top two providers, I would say, all right, telemedicine providers. There are top 3 that I know of. One is Babylon in UK, one is Ping An Good Doctor, now changed to Ping An Healthcare and Technology Company, right? Chinese is called Ping An Jiankang, right, in China. And of course, there's Ada from Germany as well, right? So Babylon Health, right? Everyone knows, potentially knows them quite well. They are one of those that actually go regional and global, and recently looking at IPO, right? So Babylon started from UK, and their success stories, right, and their key value proposition is a lot of integration with NHS in UK, right, in terms of some of the medical information, right? Of course, it's selected one as well, right? But I think Babylon Health is a success story of how a digital disruptor, right, can work very closely with a traditional healthcare provider and institution to make the entire telemedicine platform more mobile, right, serving as another channel for the traditional healthcare provider, and using technology such as AI and machine learning to really do the entire triage and reducing and giving more time to the physicians and the doctors to do more important tasks than the initial inquiries. So this is an example of a symptom checker, right? So today, I think if you're using a local telemedicine, there's a lot of direct interaction at the very beginning with the doctors, right? But in Babylon, if you try to download and use the apps, there's a lot of basic information where they're trying to collect from you, right? If you're a first-time user, and to some extent later on, a symptom checker, right? Before you are handed over to have a video or audio call with the physician. So how Babylon Health used the symptom checker, right? It actually provides the triage capabilities so that a lot of basic questions are asked before passing over to the doctor for consultation. And what do they use, right? There's a lot of technology behind this symptom checker, right? What you probably know is AI capabilities, right? So the AI capabilities is just like when we're doing a Good Doctor. There's a lot of basic clinical pathway that we need to build, right, with the doctors, right? We'll need to also build up our medication or drugs database where we can map to the different clinical pathways as part of the medication recommendations, as well as there is a need to get the user data or the patient profile, right? In Babylon Health, as I mentioned, at the very, very beginning, probably just like many of the telemedicine startup, right, we collect it through the platform, through asking questions, right? Whether is it text-based, audio, or video calls, getting the data from the patient themselves when they use the platform, right? But with more and more telemedicine startups working very closely with traditional healthcare institutions, there is a look into integrating some of this data, right? Integration can mean either way, right? Most of the time today is passing on subset of the data needed to the platform, right? To ensure data integrity and security of the patients, right? And this is the trend where user profile, user data, together with the clinical pathway, medication drug database, and others like the machine learning capabilities that helps to improve the telemedicine moving forward, right? And like you can see here, simulations, right? So Babylon Health tried to even, to some extent, predict based on the content, based on the data profile, to see what kind of things, what kind of recommendations can be given to the patients when they embark the platform, and maintain the entire, I would say, patient journey and patient management, right? Because we are moving from a fee-for-service kind of model, right, by many of these startups, right, into a value-based and a long-term health management platform, right? We do not want people just to come up, do a one-time, and then that's it, right? You want to collect the data, you start pushing content and information to them so that they can start managing their health. Again, this goes back with the entire moving from sick care into health management and empowering the citizen and patient with their own health management as well. The next example is Ping An Good Doctor, right? So this is the one that I have a privilege of working with very closely, setting up their regional offices in Indonesia and Singapore, right? So Ping An Good Doctor, again, they started as a teleconsult platform, right? They want to differentiate themselves against the competitor 5-6 years ago, where there was a lot of focus on health management, right? Because those are the less sensitive thing, right? Because people are asking, you use AI to do consult and give medication prescription. Who is responsible? Is it a platform? Is it a doctor? Is it a company? Who is going to be responsible if something goes wrong? So 5-6 years ago in China, there are plenty of companies focusing on health management. But Ping An Good Doctor chose the path of going into telemedicine in terms of consultation, right, as well as medication prescription. So that's a risk that they have taken. But I think it has proven to be a successful risk to be taken, right? It started off with teleconsult, hiring many, many doctors to start with, not just partners doctor, which many of the people doing today, right? And panel partners doctor, like the locals one, right? They started with that for a while and quickly moved into in-house doctor. So hiring in-house doctor and not just junior doctors, but very experienced heads of the different hospital and clinics as well, to really beef up the entire in-house capabilities, right? To try to function and move towards what the China government was pushing for into an internet hospital mentality and initiative, right? Started with teleconsult, moving into chronic disease management, right? Like I mentioned, that is the long-term goal of a health platform, right? Not just a one-time fee for service model, right? And moving into really the health management. So it took a slightly different path from many of the health tech, medtech startups 5-6 years ago in China, right? It started from medication, consultation, primary care to some extent, into the health management. So again, it pitched itself as the most important and the largest ecosystem of healthcare in the world, which it is to some extent, and it's invested by SoftBank as well, right? So there's a lot of possibility. If I look at where Singapore telemedicine startups are doing today, right, I would say that there's a lot of possibility. One model is the Babylon model, right, and enhancing the AI and ML capabilities to reduce the reliance on human traffic, right, or human manpower, right, to use technology to really reduce that. Or another way is to go to the ecosystem way where Ping An Good Doctor is doing, right, expanding, and that's very necessary in large population countries like China, like Indonesia, right. To some extent, it's really the consumerization of healthcare in the Ping An Good Doctor model. So these are the two that I've seen. And we're trying to, I mean, coming from both sides of the world, I'm trying to compare what's the difference of telehealth from perspective, right? Again, this is looking from an outsider view, right? I'm not working in the healthcare institution myself, right? I'm hearing from a lot of people I deal with, so I may be wrong from that perspective. I myself worked as a digital disruptor before, so I think I can kind of stand up and say what the digital disruptor may be thinking, right? It may not apply to every of the digital disruptor up there, but at least this is what I know from mainly industry perspective, right? So the motivation is really that this is a new business model, right? We want to empower the patient and citizen. We leave the health management to the patient themselves in the hand. Whereas healthcare institutions, many of them view telehealth as another channel to reach out or to service the patient, right? So there's a different objective and motivation, right? And of course, in digital disruptor, many of us are funded by VCs and investment, right? Whereas healthcare providers are using the benefits and the profit and the revenue from the current traditional revenue streams to fund the additional channel, right? Of course, I would say that there's a lot of focus on ecosystem building, as you can see, by the digital disruptor. Whereas healthcare institutions are less towards that, right? They're still looking more on probably how to enhance the entire traditional healthcare providing with the digital channel itself. So these are some of the examples of the perspective that both sides are looking at. And because of the different perspective both sides has, it may bring telehealth into different areas, right? There may be a likelihood that both the disruptor and the traditional providers providing telehealth or digital health will coexist at the same time. Okay, I think this is a very crowded slides and I don't have much time left, right? So I wouldn't go into details of that. Probably you can get a hold of this as well, right? I would say that telehealth is not looking at just the providers and the payers and the patients. It's an ecosystem, and the ecosystem also encompasses pharmaceutical company in charge of the medication, especially from a chronic disease management, which we can discuss more when the chance comes, right? Then, of course, apart from what we are more familiar with in Singapore, and maybe some of this Asia example, right? There are many different startups that I mentioned, right, in the telediagnostic area, which is kind of lacking and needs to be integrated into the entire healthcare ecosystem, right? So these are some of the examples, and many of them from Israel and US that we deal with. Okay, very quickly, so this is from NCS perspective, right? So we look at the entire patient journey, starting with, let's say, the outpatient and primary care, right? So today you walk into a clinic, right? That's the norm in Singapore. And with telemedicine, you have another channel that's possible. But even before that, we think that if you have the triaging capabilities like what Babylon offer, right, or another company is called Diagnostic Robots that we discussed with as well, right, that will be very helpful. And the telediagnostic, again, you need a lot of sophisticated thing, but some of the examples like Title Care from US, they also provide some of these diagnostic capabilities, right? And we'll see more, and we think we'll see more and more of such telediagnostic companies coming in and try to integrate with the teleconsult platform. Very quickly, chronic disease management, you need the home care or community-based care kind of patient monitoring devices that I talk about. So this is an example, right, whether a lot of them focus on hypertension, asthma, right, heart disease, right? So these are the different ones that we are looking at integrating them into a common platform. And of course, you have medication reminder, right, especially for the elderly. You need that to make things work as well. Last 3 slides, 5G. So Taiwan telco actually focus on and actually pitch on how 5G can help in telemedicine, right? Because of the connectivity into remote areas that I talk about. You can read about Faris Stone's story of how 5G and telehealth actually empower the patient and citizens in remote countries or remote areas. And this brings into another key trends that we were researching a lot in the past, right? When I was doing the global CTO role, right? One of the things is that telco providers are also entering into the health, right? Whether you have Telstra Health, TELUS Health, right, from Australia, from US. So these are the different examples where telco actually move into the healthcare industry and mainly in enabling the healthcare or health management through connectivity and through devices that can put to the hand of the patient and citizens. Sorry, last slide. So as I mentioned, very important, iron triangle, cost, access, and quality needs to be maintained, but at the same time, security relating to connectivity security and data security and privacy is of utmost importance, and it's something that NCS actually works a lot on that, and we can help you to achieve that. Okay, thank you very much. I think I shall end there. Thank you. Okay.
Thank you very much for the presentation, Jim. A round of applause for you. Thank you. Well, ladies and gentlemen, we'll be going for a 10-minute break before our next session on further personalizing healthcare with emerging technologies. We also